And one of the things that we wanted to address very early was, is there also potential for chondroitinase to treat contusion injuries? So unlike most experimental injuries, which are fine sections done with a knife or some sort of wire, a contusion injury is a big, whopping, ugly injury that has a scar that may be 2, 5, or maybe even 20 times the size of what you see in the scar on a section injury. So we did a series of studies looking at chondroitinase treatment of rats that had suffered contusion injuries at the T9, T10 Jurassic level. And we did 3 different injury levels. We did a very severe injury, a moderate, and a mild injury level. And what we were able to show is that if we treated these rats for 10 days after their injuries, we could improve their motor function as well as their autonomic function in the severe and the moderate injuries. We didn't see significant results in the most mild injuries that we did. So what we've shown here on the left side are open field locomotor scores with the BBB scale, and animals that were treated with either a vehicle, which is the blue line, a non-active protein, which is the green line, or with chondroitinase, which is the red line. And what you see is that there's a significant and sustained improvement in the walking ability of these rats that were treated with chondroitinase. Similarly, and shown on the right side, we looked at the residual urine volumes as a measure of their ability to spontaneously empty the bladders. And what we're able to show is that in animals that were treated with chondroitinase, they had significantly reduced volumes remaining in their bladders. So shown here, a pretty typical response where the animals retain urine, and then they had a partial recovery thereafter, whereas in animals that were treated with chondroitinase, they returned to near normal levels. So skipping ahead a few years, another very exciting outcome of chondroitinase research has been data recently showing that even long after an injury has been established, treatment with chondroitinase can improve function in rats. And this is work, again, out of James Fawcett's lab that was recently published, showing that when animals are treated with chondroitinase beginning approximately 4 weeks after their injury, that they can get a robust and significant improvement in their motor function. And here, the data shown is the ability of rats to grab food pellets that are placed in certain challenging conditions, and you see that they're both able to reach and grasp more pellets, and they're able to do that with less